Okay, well, good morning, everyone. Hearty welcome to this latest live broadcast from the Senior Law Day Collaborative. My name is Elena Falcone. I am the Director of Outreach at the Westchester Library System. I am also the co-chair of the Senior Law Day Collaborative, along with two wonderful women, Sarah Steckler of Washaw Bernstein and Melinda Bellis of Legal Services of Hudson Valley. And Bruce Siegel, who you've just seen, he is the person who keeps us organized and our programs promoted so that you're aware of them. And he is Bruce Siegel from Marketing Sense. But the team that represents the collaborative is more than 150 knowledgeable professionals who are eager to bring you information about legal, financial, and health topics that are of relevance to older adults. And I have to say on my own behalf, it's been an amazing education to be a participant in many of these webinars, and I am very much looking forward to today's. Before we begin, I want to make sure you know where you can go after the program is over to get more information and to get your questions answered. And with that, I'm just going to take a moment to share my screen. And I'm going to make sure that you are aware of what is on the seniorlawday.info website. So seniorlawday.info is where you can come for the recording of today's program. You would go to the 2021 webinars banner that's over here. And when you expand it, every one of these titles is in fact a quick jump to a webinar. And if there's been any presentation materials or other things, they're also linked there. And you'll notice that a lot of the topics are all kind of mutually supportive of each other. So Elder Law 101 can help you out. More information on nursing homes can be relevant. 67 decisions to make that when a death occurs. Before we get there, though, let's talk about aging in place. So we have a lot of information here that is available for you as a follow-up to this. And sometimes, says the librarian, hearing someone speak to me about these facts gets into my head and I understand it more. And sometimes I have to read it and hear it multiple times. So here you go. Here's the place to come and listen. Something else I want to point out at the top of the page under resources, you'll see our Elder Law Q&A. This is a book that is updated annually, and it's available for you on this website. And as you browse down, you can see here the table of contents for this. So there's a lot to look up. Our presenter is going to mention some of the topics in here, and there's more information to be found. We update this during the year as well, so you'll see updates posted to this page. So keep that in mind. And finally, on this website, the other big thing I want to call out is the Ask Us button. So if you click on this button over here, what launches is a live chat opportunity and or an email form. So you can send us your questions after this event. So I'm going to stop my presentation and then also say, let's talk about this event right now. You are in a webinar format. You'll see on your device, hopefully, a Q&A button. Please use that for your questions. We will, the presenter has very nicely said that he would take a break periodically to field some questions. So put them in there, but know one thing, if we don't get to your question, we will get back to you, because unless you've asked the question anonymously, we have the ability to see your email and we will actually follow up. So we're here to help you get information today. Whew, okay, got all that covered. Today's presentation, how do I pay for long-term care? As a librarian, one of the most common questions that I think comes to me when people know that I'm working with the Senior Law Day Collaborative. Our presenter today is an elder law attorney and chair of the elder law section of the New York State Bar Association, Deepankar Mukerji. And I have to say, he's also a really nice guy who has a good heart, amazing intelligence, and an ability to explain this information in a way that I think will help us make decisions in the future. So with that, Deep, can you take over?
Welcome. Thank you so much, Elena. That was a very kind introduction. All right, let me see if I can get my screen to share, and let's get started. Let's see.
Yes,
here we go.
Got it.
Okay, everybody can see that. All right, so this is me, and we're going to talk about paying for long-term care, which is, it's like a magic trick. Nobody's really figured out how to do it, though. But people talk about it all the time. And why do we talk about it? Well, long-term care is very expensive. It's extremely expensive. Most people can't afford to privately pay for long-term care. So I have some numbers up here, but these numbers are, I got them from the state, and frankly, they're a little low. All right, I find that our numbers are a little higher. So when we say nursing home costs from $340 per day, I think that we're probably closer to about $500 a day. $500 a day is what it will cost you in a nursing home. And home care. Again, I'm using a state number. They said 22 an hour. I don't know. I see very commonly, I see 29, I see $30 an hour. So it's very expensive, right? 30 bucks an hour. And you talk about an 8-hour day, it's $240. I mean, so long-term care is extremely expensive. All right. What are our mechanisms to pay for long-term care? Well, so most people have Medicare. I think most seniors get it. It's something that you get at age 65, or if you're disabled after 2 years. But it requires a work history. Okay, so Medicare requires that you have 40 quarters of qualifying employment where you paid into the system. But once you pay into the system, then you're qualified for Medicare. It has deductibles, it has co-payments, and it will cover it covers hospitals, it covers doctors. As you know, if you have a Medigap policy, it will cover most of your costs, and it covers your medications if you have a Part D program. Does it cover long-term care? Well, it covers rehabilitative stays in a nursing home. And the maximum that it will cover is 100 days. All right, 100 days. That is the maximum. And I see that most rehabilitation centers are discharging people before the 100 days are up. So you rarely get the 100 days. But if you really, if you're really in bad shape, you'll get 100 days. The first 20 days are no copay. First 20 days, no copay. So it's all covered by Medicare. The next 80 days require a copay. The copay is currently $185.50 per day. That's 2021. Next month, in January, it's going to go up to $194.50. All right, that's so that's almost 200. It's about $200 a day. If you have a Medigap policy, certain Medigap policies will cover some of that. Okay, will help with the copays. Not all. So you need to check your policy on that and check with your insurance agent. So does it cover any home care? So, well, it will cover rehabilitative home care. And what it usually will cover is some home care, some skilled care, some therapy, a certified home health, a certified home health agency services, but the hours are going to be limited. They're going to be about 8 hours, and most likely you're going to see this after a discharge from a hospital or from a rehabilitative from a nursing home, from a rehabilitative stay in a nursing home. So when somebody is transitioning home from a facility or from a hospital, they will get some home care that will be covered by Medicare. But the hours are going to be very limited. They're going to be 8 hours, maybe 10 hours a week. Okay. And if somebody needs extensive care, that's not going to work. Medicare does not cover what we call chronic care. All right. Chronic care or custodial care. All right. Medicare does not cover that, does not cover custodial care. It only covers rehabilitation. And so, all right, so, well, you're not getting enough hours for Medicare. What are you going to do? So your first option, and generally one of the popular options, is to use a licensed home care services agency. All right, or we call them LICSA. There's a lot of alphabet soup around here, but so you got this private home care services agency. Again, they're going to charge you, and I have here $22 an hour, and that's what I got from the State Department of Health. But in reality, around here, that might be good up in like Schoharie County or something like that. But it's not going to be what you find in Westchester. I think you're going to find $29, $30 an hour. Okay, privately paid. If you have long-term care insurance, which we're going to talk about more, if you have long-term care insurance, that may pick up part of that bill. It may pick up some or all of the bill, depending on your policy. So LICSA services, licensed home care services, may be covered through long-term care insurance. They will not be covered by Medicare. Will not be covered. All right. So the other thing that we talk about a lot is Medicaid. All right. Medicaid will pay for long-term care. Medicaid will pay for custodial care. It's known as a payer of last resort. When you have no money, when you don't have enough money to pay for your medical bills, then you can apply to Medicaid. I'm gonna talk a lot more about this, so just bear with me. I'm moving a little bit quickly, but I'm gonna stop in a couple of minutes here. I just want to. So I want to go over the various kinds of programs, and some of them you may have heard of before, some of them you may not have. The various Medicaid programs. Medicaid has a lot of programs for home care, and okay, so let's talk about it. Managed long-term care. Managed long-term care is right now the main form by which people receive Medicaid home care services. They have to enroll in a managed long-term care provider, which then determines how many hours they get, what kind of care that they get. All right, so it's a little bit like an HMO, in that it's a medium. You have to go through them to get your care. What kind of care might you get? Well, you might get personal care or home attendant care. Personal care or home attendant care is generally what's considered non-skilled care. All right, it's custodial care. They can help you with your activities of daily living. We're going to talk about that, but they will not provide any skilled care, such as the administration of medications, trach care, vent care. Those kinds of things are skilled and would not be covered under that. There's also a program called the Consumer Directed Personal Assistance Program. And this became really popular, became popular upstate, but it became popular here a few years ago when they opened up the program and said that you could hire anybody. The Consumer Directed Program allows people to hire their own aide. All right, they can select their own aide, they hire them, they direct their activities. All right, the consumer does it. The consumer says, I need this done, or a person who is appointed as the representative can also be that person to direct the activities of the attendant. So like I said, a few years ago, they opened this up and they said, well, you could hire family. You could hire your own family to be your assistant, and they will get paid, and they'll get paid through Medicaid. So that's become a popular program. So then there's also adult daycare services. Adult daycare services allow you to get care, maybe medical care, but also some social care. There's a place that you can go during the day you spend the day there, and then so there's socialization. There may be entertainment programs. There may be there's be a bunch of things, but there's also on hand there would be attendance, and there would be most likely a nurse available, so that if somebody needs some medical care during that time, they could receive it. And let's see, there's the program of all-inclusive care, which is a program that sort of provides all services. Okay, it's one-stop shopping. You enroll in it, and depending on what your care needs are, you receive them. So you could receive home care, you could get daycare, you could get nursing home care. It's supposed to cover everything. All right, it covers, and so you can enroll at a certain point in your whatever your status is. So if you may not need a whole lot of care when you initially enroll, then you would you just receive a few hours a day. But if you're in the program for a few years, your needs may increase, and once your needs increase, the program will continue to take care of you up until the time that you need a nursing home. All right, so and the last program is the Nursing Home Transition and Diversion Program, and that's a program that's designed to direct people home from nursing homes. All right, they're supposed to come home. If you're in a nursing home but you really don't belong there, you could really be cared for at home, then you can be transitioned from the nursing home back home. Also, it's supposed to prevent people from going into a nursing home. So if you need nursing home level of care, then you can enroll in this program, and they'll try to maintain you at home. They could provide home adaptations as well as home care. So if you need railings, if you need some a ramp or something like that, that may be covered under that program. All right, I'm going to stop. Do we have questions?
Actually, yes, just want to back up a sec. Who did you say gets managed long-term care? Who qualifies for that?
Anybody who is a Medicaid enrollee. So if you
Anyone who
qualify for
didn't-
Medicaid, yes, and you need home care, then in fact you have to enroll with a managed long-term care agency.
And when you were covering the average rehab stay and the costs associated with that, there have been a number of instances where there are people who are in rehab, but the ability to transition to home care is difficult because of the lack of available home care staff. People who you can hire. That's been a real crisis, I think, of late, particularly in different parts of Westchester County. Have there been any changes if you have to stay in rehab longer because you can't hire someone to come and continue your care at home? Nice to have a nursing home transition and diversion, except if it doesn't work. So anything about that?
You're absolutely correct, Elena. It's a real problem these days, and there's been a lot of difficulties in getting care, and we have a labor crunch, I guess, throughout the country, and it's being reflected especially in home care. So it's been very difficult. I'm still hearing a lot of people have a lot of difficulty. So that they have approved hours for Medicaid, but they still are not getting. They're not able to get somebody to fill those hours. So it's a problem. Yeah, I have no magic for that one. Yeah.
Well, I know it's a concern of some of the some of the people who are engaged in this in the county. So that's good. I guess we can only say we hope that planning is going to help. Okay, thank you.
Okay, so let's move on. All right. So when I talked about the activities of daily living, and this is usually what you get your home care. This is what usually has home care. Is focused on this. All right. So generally what we understand to be the activities of daily living are eating, bathing, getting dressed, toileting, transferring from a bed to walking, to a walker, to a wheelchair, and back again, so and continence, maintaining and changing the adult garments, adult diapers. Okay. And so those are the activity of daily living. Now, this is long-term care is usually very focused on this. The long-term care insurance policies usually require assistance with activities, with two of those activities of daily living. All right. So if you need help with two activities of daily living, most long-term care insurance companies, the policies will kick in. All right. Policy will kick in. You can then get home care as long as you need assistance with two. Medicaid had no requirement previously. All right. They previously had no requirement that you have assistance with two activities of daily living. They just said that if it was medically necessary for you to receive these services, you would get them. All right. So there's been new regulations. There were some laws passed in 2020, and they're slowly being implemented. All right, but not really. Right now, everything has been pended because of the public health emergency, and I'm going to talk more about that. But what this Department of Health is saying is, well, we're not going to do anything right now. We're going to wait till the public health emergency is over. And part of it has to do with their funding that they receive, because they're receiving COVID funding, and they don't want to jeopardize that by making the program more restrictive. There are federal requirements relating to, so there's some conditions on the federal funding. Anyway, but there are these the feds have approved the regulations that went in have gone in, but they don't have it quite done yet. So the regulations would require assistance with more than two ADLs. Okay, so just like that long-term care insurance policy, now Medicaid is going to require that you need help with more than two of your activities of daily living. However, if you have a diagnosis of dementia, then you just need assistance with more than one ADL. Now, what does more than one? More than one mean? Does that mean two? The way the regulations are written, it could be 1.5. So you need a little bit of help with, say you need a little bit of help with bathing, and but you need help transferring. That would be that might work as 1.5. I don't know. We don't really know what that looks like, what 1.5 looks like. But anyway, so that's what they say: more than one. Or more than two. These regulations were finalized recently, but then the state said they're going to pen them. Like I said, part of it is because what they need to do is they have to change their systems. All right, in order to do a major change like this, where all the assessments are going to require this evaluation of the activities of daily living. So they need a new assessment tool. All right. And what they've done also is they're saying that they want a single state agency. This like statewide network of doctors and nurses who are going to do all the assessments. It used to be that, the county public health nurse could do it, could do an assessment, or a long-term care agency, one of those LICSAs, could do the assessments. But now they want one statewide agency to do all these assessments and to figure out, what care people need. So clearly something that major is going to take time to put in place. The other thing that the regulations cover is they want to create an independent panel to look at cases that are more than 12 hours a day for home care. So if there are cases that have more than 12 hours, they're supposed to look at them and see whether it's appropriate. And that's kind of ominous. We're not happy about that. At the Bar Association, we've been working very diligently to try to oppose these, to try to stop some of these changes from happening. But right now, the regulations are there. But again, they're not implemented until this whole system is sort of reformed and put in place. That's the indication from the state, that they're gonna want to have everything in place, and then there'll be policy guidance that we can all look at, and I could tell you a lot more about what these regulations are going to mean in terms of changing how you get your care through Medicaid. Okay, so there we go. So these are the residential. Those were home care options. Now let's talk about the residential options. All right, residential options are assisted living, and assisted living is very popular, but they're all different kinds of assisted living. All right, most assisted living that you see around here, let's say like the Kensington, for example, is private pay. Most of it is private pay, and it's very expensive. I mean, I think some of these are about $15,000 to $17,000 a month, and they may even be more. So they're a lot of money. They can be very, they can be very nice. They can provide lots of care. They usually provide, your meals. They provide care on an as-needed basis. And it's kind of shared. I mean, you might share aids with other people, but they will generally cover all of your needs. Some of them are more medically based than others. Provide levels of care that are higher. Some of them are less. Some of them are just kind of communal living places. These are generally not covered by Medicaid. There are assisted living program facilities which are covered by Medicaid. All right, they're a little different. They're similar. They're based on the assisted living model, but they're only, there's actually somewhat limited choices. There's more in other counties, but in Westchester, I'm only aware of one that actually takes people. And that's covered by, that would be covered by Medicaid. So also, I mean, there are different levels of care. When you have an independent living facility, which is a little bit less care, although it might provide the meals, and it might provide care. All right, there's some independent living facilities, and there's some assisted living facilities also that sort of qualify in this area. Like the Atria is one, where if you can privately pay your room and board, you could get Medicaid to pay for your care. All right, and that's generally true of most independent living facilities, like places that will provide maybe a lower level of services, but they'll provide meals, and they might provide something else. If you can get your care from Medicaid, as long as you're paying your room and board. Now, you can't get Medicaid if you have too much money. So the room and board piece is a little bit tricky. I don't really have time to talk about that today. I'll try to get to a little bit of that, but there are ways to do it. There's also continuing care retirement communities, and these are all-inclusive kind of places. They're private pay, where and I think the Osborne in Rye is an example where you can actually get a house. You could be in a little house, sort of on the grounds, and basically be on your own. But then if you need, as you need care, you can move into the assisted living apartments, and then you can receive more care. But and if you need more, then they actually have a nursing home too. So they're like, again, one-stop shopping, cover everything, a continuum of care. They cover everything from independent living to skilled nursing facility. They are strictly private pay. None of them accept Medicaid. Some of them are very reluctant to accept Medicare even for certain services. So there's some issues with that. But yeah, they're private pay. They can also be very expensive. They usually require a large deposit of funds up front, and then a monthly payment. And the last thing is skilled nursing facilities or standard nursing home. Uh, those can be paid for privately, again, very expensive. Medicare, as we said, covers up to 100 days, or Medicaid. So Medicaid will also pay those. All right. Do I have some questions at this point? Elena, you want to?
There's a question about, can you go from nursing home, I want to make sure I get the question right. If you're currently in a nursing home and you are, I guess, having it covered via Medicaid, can you move from that to the PACE program that you mentioned earlier?
You may be able to. You may be able
Right,
to enroll.
investigating. You have to qualify for both Medicare and Medicaid.
Yeah, they may not want to take you because you're already at the highest level of care, and they're going to say, well, we would just put you in a nursing home too. If you're in a nursing home, but if you're appropriate for the program, they may accept you. There's no reason for them not to consider.
What would be the benefit? What would be the benefit of shifting?
Maybe to get you home. If you're in a nursing home and you're able to get home, they could help you probably come up with a plan for that. So
I wanted to say that. Okay,
right.
And there's a question I'll save for later. Okay.
Good.
Yes, I'll save a couple of these for later because I think they're sort of a summative ones for what you're about to cover.
Okay, good. All right. Yeah, because I'm let's see, how much time do I have? About half an hour. Okay.
Yeah.
I'm okay. I'm all right with time.
Well, there is one. Do these benefits vary from state to state? They do, but which ones?
They do. What kind of care people receive? It does, the home care programs vary a lot. So a lot of the stuff that I'm talking about is very specific to New York State. Frankly, in a lot of places, there is no home care. Even upstate New York, there's very little home care. We're actually quite fortunate that we have a service-rich environment here in the New York City area, the metropolitan area. We're lucky, but again, it's now you can't get an aid. It used to be really quite work really quite well, but we've had some problems recently, so it's starting to get tougher.
Changes all the time. All right.
Yeah. All right. So okay, let's talk about long-term care insurance. So like I said, long-term care insurance could cover some licensed home care services. It can cover time in an assisted living facility. It could also cover nursing homes. This all depends on the kind of policy that you have and how much, what are the levels. All right. Generally, there's a couple of different kinds of long-term care policies. They can provide reimbursement. So you pay for some care, and then you submit the bill to the long-term care provider, to the insurance company, and then they reimburse you. Or sometimes they will pay directly. Okay, sometimes they will pay the provider directly. And so generally there are fixed amounts that they pay. There's usually what's called an elimination period. I don't really understand why there is, but this is just the story. There's an elimination period of 90 days. So that means that from the time that you needed the care, you're on your own for 90 days. The policies will not kick in until you've continually needed this care for 90 days. But that's what it is. That's what an elimination period is. But after the 90 days, the policy will kick in and provide reimbursement or payments. They have the premiums are based on a person's age and health. So they have to accept you. Most likely, if you are, at a certain age, they're not going to really want to insure you. So that's an issue. Also, if you have health conditions, you may have a problem. So, the adage on long-term care is that long-term care insurance is you should get it when you're young and healthy. So hopefully if you're in that situation, you can do it. Okay. Yes.
A cool question about this. Does the elimination period start when you need care or when you start to receive care? So it's, if I think I need it later on, or weekend? Like, when does that start?
It's going to basically be based on an assessment, but you have to apply. Once you apply to the you have to apply to the program, to the policy for coverage. So you have to need the care. You may not actually be getting it at that point, but as long as they determine that you qualify under their guidelines for receiving coverage, then they will cover.
And what you're flagging is that these guidelines vary, so we need to know the details of our policies. Okay.
Well, generally it's going to be 2 ADLs. Like I said, it's going to be two ADLs, or you are in an assisted living facility, or you're in a nursing home. All right, those would be the situation. So policies may vary a little bit, but it'll also depend on they will have a certain standard, a certain threshold that you'll have to meet in order to qualify. Look for one of the things that you should probably consider if you're considering a long-term care insurance policy is an inflation rider. Which allows, which provides for increases. Those costs that I was talking about, they're always going up. They're going up every year. They go up. The price of a nursing home, the price of home care, all that stuff is going up. So an inflation rider is very helpful in a policy. Also, premium waivers. You shouldn't have to keep paying premiums after you start receiving the policy benefits. Usually what happens with that is you can stop paying your premiums and they just, and then you just receive the benefit. Now, some of these for the premiums on some long-term care policies, probably most of them, but they have to be qualified, you get a tax credit from New York State. Not a federal tax credit, but a New York State tax credit. But it depends on the policies, and I would talk to your broker about that. Okay, just briefly to cover the New York State Partnership for Long-Term Care. That's a particular type of long-term care insurance policy. All right, that's a policy where New York State partnered with the Department of Health to create this program. Going back to 1993, where they created this program, which said that you were going to, if you enroll in this particular long-term care insurance policy, you will, you can receive your benefits once you start, once you need benefits, but once those benefits are exhausted, once you've used up whatever benefits were covered under the policy, you will automatically qualify for Medicaid. All right, so Medicaid will pick it up after that. It could, and this was generally how it used to work. It's 5 years. It could cover up to 5 years of home care or 3 years of nursing home care, and after that, Medicaid would start paying. All right, regardless of how much assets you had, you could have millions of dollars in the bank, but you would still get automatic Medicaid. All right, those policies are getting very hard to find, and they're also expensive. However, a lot of times now you can buy a certain amount of asset protection, and that's called a dollar for dollar program, where you say, say you buy $500,000 worth of coverage, you get to keep that, you get to keep $500,000, and you will qualify and you still qualify for Medicaid. So that's kind of how that works. Your income, though, you would still have to be paid towards the cost of your care. All right, especially for nursing homes and stuff. That your income needs to be paid. Needs to be paid. Medicaid requires that income be paid towards the cost of care. Portability is if you say you have a policy that you bought in New York, and then you move to New Jersey. Can you still use this policy in New Jersey? And the answer is sometimes you can. There's participating states. I don't have the full list of participating states, but a number of states allow for you to move there and to still use that New York policy. All right, so there are generally states that have similar programs. Okay, do we want to? I think we haven't. Well, all right. Let me go.
You
Let
keep
me
on
start with
going.
this. Yeah,
You
I'm gonna
keep on
keep
going.
Okay. All right. So let's talk about Medicaid. Uh, Remember, I said Medicaid will pay for long-term care, uh, and it is what's called the payer of last resort. It's a means-tested program. It has limits on how much assets you can have. All right, so you can't have too much money and qualify for Medicaid. All right, yeah, it's like I said, it's after every other option that you have is exhausted and you have no more money to pay for your care. All right, that's what Medicaid was set up as being. It has now become, it's become the major payer of long-term care throughout the country. All right, Medicaid pays for most long-term care, and most of it is nursing home. But that's what it was originally set up to be for. For those situations where people had exhausted all their resources, they had nothing left, and they needed care. So that's what Medicaid is set up for. That's why it's means tested. All right, you cannot have too much money and qualify. All right. It will cover all the stuff that we talked about, though. It covers a lot of stuff. All right. So what are those? What are the limits? Let's talk about that. The limit of the income limit is $884 for a single person monthly in 2021. All right, $884 and a $20 unearned income exclusion. Now, I don't know about you, but that's really not enough money to live on, right? I mean, that's pretty low. 800, that would be $904. That's how much you get a month. And it doesn't usually cover rent. It's not going to cover rent and food, or rent and utilities, or whatever. It doesn't cover a whole lot. For a couple, it's $1,300, again, with that $20 unearned income exclusion. So it's extremely low. All right. That income limit is, something that is kind of daunting. But however, if you have excess income, you can still qualify for Medicaid. All right. If you have more than that, like I said, $904 a month is not much. But if you have more, you could still be eligible for Medicaid. What Medicaid says, though, is that what you have to do is you have to take your excess income, which means anything over that 904, and pay it towards the cost of your care. You pay it toward, it's considered surplus income. And if you pay it towards the cost of your care, then you will qualify. Then you've spent it on medical. It's got to be medical or home care. It's got to be things that would have been covered under Medicaid. So you have to use that excess income. Again, it's probably not very helpful, because if you need more money than that to live on, it's not going to really work, right? I mean, if you need more than $904 a month to live on, you can't be spending it all on your care. So there is a solution to that. There is you can use a excess income, that income surplus that I was talking about, the amount over the $904 a month, can be paid to a pooled community trust. All right, a pooled community trust. That is a special kind of trust. They're run by not-for-profit agencies. There's a bunch of them in New York State. So they are not-for-profits. They set up these trusts, and the trusts are specifically for disabled people. So you have to have a finding of disability, which you probably would qualify for if you're looking for long-term care. If you're looking for long-term care, you probably would qualify as disabled, most likely. So if you're disabled, you can put your money into this pooled community trust. And that way it can be used for non-medical needs. All right. It could be, then you could use it for food. You could use it for rent. You could use it for mortgage payments, tax payments. You could use it for Con Ed. You could use it for all kinds of things, as long as they're not things that would be covered by your Medicaid benefits. All right, non-medical, generally your non-medical needs, and that's what these pooled community trusts are for. And when we say pool, that means that there's a bunch of people. You know, you enroll in it. There's a bunch of people. You all pool your money into this trust, but you have a separate account. You have a separate account. You're not mixing your money with that, but it's just considered a large, you know, it's a large trust with many members. Okay, so that's what you can do about the excess. That's the solution to the excess income problem, and how you can get by with you know, get Medicaid with only 900, you know, with income over $904. If you're in the managed long-term care program, you could, those limits could apply, but you could also do what's called a spousal impoverishment budgeting, which allows you to allows the person getting the care gets to keep $416 a month, and a non-applying spouse can keep up to $32.59 per month. However, you can't use a pooled community trust. So with that kind of budgeting. So the other budgeting is probably more worthwhile. Most people will opt for that and use a pooled community trust. Okay. So Medicaid considers everything in terms of income and resources. All right, it goes in one bucket or the other. It's either income or it's a resource. And resources are, you know, what do you have? What do you have in the bank? What are your assets? And the limit on resources is 15,900. All right, and that's in 2021. 2021, the resource limit is 15,900, which, you know, it's not terrible, but it's really not a lot of money. Again, especially if you have long-term care needs. But that's the resource limit for a family of two. If they're both applying, 23,400. All right, that's the resource limit. For nursing homes and for MLTC coverages, the managed long-term care program, a community spouse can keep up to 130,000. This is for somebody who's not applying. So your spouse is ill and needs care, but you're healthy. You can keep up to $130,000. Up to. It's a sort of a sliding thing between 74,000 and 130, depending on what your assets are. If you have more than that, if a non-applying spouse has more assets than and they would be that would make the applying spouse ineligible, the non-applying spouse can refuse to provide support. Okay, can say I can't afford to pay for my spouse. You know, they just issue a statement. They said I can't afford to pay for my spouse's care, and so I refuse to provide that support. Medicaid will then cover the applying spouse. All right, they will cover the applying spouse, and they will just base the application. They will just base his or her eligibility on that individual's assets. And you could do this for home care. You could do it for nursing home care. However, what happens is that it will create a situation where the state or the county can actually initiate a spousal support proceeding to recover the amount that they paid. You know, so it's similar to child support. It's it would be a legal proceeding in which they recover the amount that they've paid. All right, we're going to take a.
There's a question for the.
Okay.
You mentioned what's in the bank. Is a residence included? So that asset when they're making that consideration.
Yeah, hopefully I'm going to cover a lot of that. I'm going to start,
Right.
Getting into some detail about that. But no, it doesn't include your residence. Residence is exempt. And I'm going to talk more about that. do I have this? All right, anyway, okay. Um, so if you, this was, until recently, it still is the case. If you had $1 million today and you decided to give it all away, and then walked into the Medicaid office the next day, would you qualify for care? Because it's like, well, I told you, you can only have $15,000. You had $1 million, you gave it all away. And now you're saying, oh, I don't have any more money. I need care. Could you do that? And so the answer is, for home care, yes. You're not going to qualify in that month, but in the next month, you would qualify. All right. That would be what's called a transfer for less than fair market value. You could do such a transfer and then qualify for care the next day. So that is okay. Yeah, I'm sorry.
Is that 3 months or 30 months? I thought that there's a couple of us are wondering if that we thought that period had
Yeah, I'm going to
increased.
talk. All right, I'm going to talk more about that. Right. So that until recently, that was the law, that you could just transfer money, qualify for home care. In October 2020, you had a new law that went into effect that said you could no longer do that for home care, that there would be a 30-month look back during which they would look for transfers of assets. All right. Now that was October 2020, about a year ago. And what happened is, because of the public health emergency, because of some resistance from the federal government during that time, this was never implemented. All right. It was pushed back, and it remains pushed back. All right. It has not occurred yet. Now, I spoke with representatives from the Department of Health in September, and they tell me that the realistic estimate for when that new look back for home care would take place is going to be July 2022. All right, that would be the earliest. I mean, we don't know how. There's certainly been a lot of shifts in terms of where the public health emergency has gone and how it's been, what has happened. We've had these various waves. We've had now we might have a new strain that we have to worry about. So the state has been pushing this date back. They have not implemented it. All right, it remains on the books as a law, and technically, if you make a transfer after October 2020, it may impact your home care, but it won't right now. Okay, there are no penalties for home care transfers. All right. So
And thank you for giving us the latest on this. I know we're probably, just a heads up to those who are attending, since we started a little late, we're probably going to go about 10 minutes over. So just a heads up.
Okay. All right. So yes. So there is planned to be this look back, a 30-month look back and transfer penalties for home care, but it's not happened yet. Okay, and it's still is up there. We expect July 2022. It might even get pushed, further, depending on where we are in terms of the public health emergency. So and also there are a number of other factors. The federal government still hasn't really approved the state's plan for that. They're providing funding. All right. So that's what happens for home care. For nursing home care, it's a little different. All right. If you transfer that money, they're going to say, nope, you transferred the money and you're not going to qualify. All right. And if you did it anytime during the last 60 months, then you're going to get a penalty. And I'll talk more about how the penalty period works. But so what could be a transfer? Well, it could be an annuity. You created an annuity. You could create a promissory note. You could receive a mortgage. You could make a transfer into a trust. So there's a bunch of different things that could affect, that could be considered a transfer. But basically, it's any time you like give away money, gift money, and you don't receive market value, or you give something to somebody else. So your home is one of those things. Now homes are generally exempt, like I said, but there's a limit on home equity, $906,000 per person, per applying person. But if a spouse or a minor child or a disabled child is living in the residence, the home remains exempt. So generally, that's not going to apply too often, except if the home is, if you're the only person living in the home, then that $906,000 limit on home equity would kick in. So that's what I said. These are transfers. Like I told you, it's going to be July 22 at the earliest. Putting money into a trust is a transfer. However, once you get past that 5-year look back period, so if you established a trust 5 years ago, then that is no longer falling under the look back, and those assets would be protected. So that's something to consider. Okay. This is the look back that I just talked about. Like I said, anything after October 2020 would potentially. So the idea is, if let's say it's in November 2020, you transferred some funds, and then you're applying sometime next year, sometime like at the end of next year, after this look back has gone into effect, they would go back to October 2020. All right, that look back is going to go back to 2020. It just doesn't exist yet, though. There is no look back now. All right, and I think that's about all I'm going to say on it. I just let's see. This is the look back. You have to provide financial documentation for the past 60 months. All those transactions are going to be reviewed, and they look for transfers. All right, so when you apply for Medicaid for a nursing home, you have to, they're going to want everything. They want everything for the last 5 years. You give it to them. They're going to look it over. They're going to look for any of these transactions that would potentially result in a penalty. And they're going to look at transactions that are over $2,000. So if there's a transaction that's over $2,000 and it seems like to be a gift, they're going to pick it up. So this has to do with when does the penalty period start? When would it start? So you transferred this money 2 years ago. You transfer the money 2 years ago, and you're applying now. So I need the care now. I don't have any money left, right? I did give some money 2 years ago for something, but then I kept some money, but now it's all gone. So what they do is they say they consider you have to be otherwise eligible for coverage, which means that you're in a nursing home, or with the home care penalties, you have to be receiving long-term care. That's very unclear. That's one of the problems with that law, which is why I don't know when it's ever going to get implemented. But all right, you're in a nursing home, and you have no money. You have less than $15,900. Your insurance is all exhausted, and your long-term care insurance is exhausted, or not covering the full amount of your care. And so that makes you otherwise eligible, because if you hadn't transferred the money, you would be qualified for Medicaid. That's what otherwise eligible means. You would qualify, except that you transferred money. All right. So what happens then? Well, once you're otherwise eligible, let's just do a quick. This is a quick bit of math, but it's easy math. All right. So let's say you transferred $132,000 in May 2021. So a few months ago, you gifted this money, and so now you are Medicaid eligible. You're otherwise eligible. Now you're in a nursing home. Okay. So what happens is that they take that amount that was transferred, $132,060. They divide it by the regional rate, which the state establishes for various regions every year. This year in 2021, the regional rate is 13,206. So what they do is they take the amount transferred, they divide it by this regional rate, and that's the divisor. And what do you end up with? The quotient is 10. All right. So that means 10 months of penalty. That means 10 months of penalty. When does it start? It starts when you're otherwise eligible for Medicaid. It doesn't start when you transfer the money back in May. It starts now. If you're in the nursing home in November, that's when it would start. So a penalty period would start November 1st and end, it would go back to November 1st. They're going to say, we're not going to cover November. You were otherwise eligible in November. And it's going to keep going until August 31st, 2022. You have 10 months during which there will be no coverage of that nursing home, and the nursing home has to be paid, in order to stay there. Obviously, it's a large bill that's going to come due every month. There's some things that we can do about that way beyond today's discussion. So, but yeah, it's that would be the issue. That's how a transfer penalty works. All right. So we talked about transfers. What makes you disqualified. There are certain things you can do that where transfers are exempt. Okay, you can transfer your home. If you can transfer your home to your spouse. You can make any transfer to your spouse, and the spouse, and that's exempt. All right, you can spouses are legally responsible for each other. So generally, they're going to have to provide all their financial documentation, and they're expected to provide the care unless they refuse. So, but you can transfer the home to the spouse, and transfer to a disabled child of any age. Again, has to be a homestead. You could transfer to a caretaker child. So if you have a child who's living with you in the home, and the child's been living there for 2 years, taking care of you prior to when you went into a nursing home, then you could transfer the home to that child. You could also transfer to a sibling. You have a sibling, it sort of like usually comes up with family property. People, you have some, a couple of siblings who own a homestead, and provided that they're living there. All right, the sibling's got to be living there. That you can transfer to a sibling. So again, this is a transfers of things other than a home. Like I said, transfers to a spouse, no penalty. Transfer to a trust for the sole benefit of the spouse. That means that that's sort of like an annuity where you transfer to a trust, but the trust has to be actuarially sound and pay out to that spouse. That would be exempt. Transfers for the sole benefit of a disabled child are exempt. However, you may affect that disabled child's benefits, so you got to be careful about that. Most likely, you'd want to do that into a trust. So you could transfer into a trust for the sole benefit of a disabled child, or to a supplemental needs trust or trust for the sole benefit of any disabled individual under age 65. Or to, like I mentioned before, the pooled community trust where you can put your excess income into. Those transfers are, they're not exempt if you're over age 65, but they're presumed to be for your benefit. All right, they're presumed to be for your benefit, and what the state has said is if that money is coming back to pay for your expenses, then it's not a transfer because you put the money into the trust and then you actually receive it back. So that is potentially not a transfer penalty. Let's see. Again, it's got to be for less than fair market value. That's it's a gift, transfer. So let's say you decide to sell your house to your child for $50,000, and you know that the house is actually worth 500. Well, you received money, but you didn't get the full fair market value, and the difference between what you received and the fair market value is what's going to be penalized. And we talked about home equity, $906,000 for home equity. However, if your spouse is living there or a minor or disabled child, then the $906,000 home equity limit does not apply. If there's jointly owned property, then and you're both applying, then each person gets that $906,000 home equity exemption. If you take out a reverse mortgage or you use a home equity loan, you can reduce that equity. All right, so you could do like a cash out mortgage. Say that your house is worth over $1 million. You could take out $100,000, $200,000, and but then you have too much money. But if you spent that money on your care, you would then qualify for Medicaid, and your home equity would be reduced. Okay. Actually, I was rushing a little bit, but I did want to talk about, and I'm sorry that I may be missing the slide here, but I did want to talk about what constitutes assets. And when we talked about resources, what are resources? So I did want to briefly talk about that. Like I said, the home is exempt. What else don't we count? Well, we don't count retirement accounts. All right. Retirement accounts are not a resource because they are generally, as long as you're receiving periodic payments from them, they are income. So, like I said, that Medicaid looks at things. It's two buckets. It's either income or resources. So it falls into one or the other, but not both. And so retirement accounts would count as income as long as you're receiving your periodic distributions, meaning the required minimum distribution. If you're receiving that every year, it's not going to count. Otherwise, everything else is pretty much on the table. Okay, thank you so much, and I'm happy to take questions.
So you're saying the bottom line is that the nursing home does have to get paid, so that they're gonna look at the assets that they can, with the resources that they can. There are a couple of very specific questions, and I know we have to wrap up. But I think I get the answer. If the transfers are made to a spouse and then the spouse gifts those funds to children or someone else, is that okay?
No.
Yeah, no. In terms of the look back period.
Answer, straightforward. No, spouses are going to be considered together in terms of financial eligibility. There is a rule though that if you do this, and then once the spouse has the spouse who's in the nursing home is qualified for Medicaid, 30 days after that case has been approved, they no longer consider the spouse's assets, the well spouse, the one that's at home. They no longer consider that spouse's assets to be available. So potentially transfers could be done after that, but we'd have to be careful. I mean, that's something that's a little bit complicated for today's discussion.
Yeah, so when these transfers are in place, that's really key. As sort of the same line, if the transfer is less than $2,000 a month to your child, would that or would that not be part of the 60-month look back?
Generally, they're not going to look at things that are under 2,000, but that doesn't mean that they can't. They might. If there's a recurring pattern, it's possible that it would be picked up.
A recurring pattern. Okay, thank you. And someone just shot in one that's particularly interesting, that if they'd read on Medicare.gov that the PACE program, people with Medicare are only eligible if services only if we're eligible for services if they pay the Medicare capitation fee. Can you explain and confirm?
I'm not really sure what the Medicare capitation
Fee is in this one.
Yeah,
So
that's something.
We'll get back to you on that one, maybe.
Yeah,
Oh,
I am sorry.
okay.
I got a punt on that.
And one question that just threw me: what is the benefit of carrying New York State Medicare to another state?
No, Medicare is a federal program. Is a federal program, so it's good in all 50 states. All right, it's, you know, it may look a little bit different, may cover different things, but Medicare is a 50-state federal program. Medicaid programs change a lot, you know, but you can't carry them. I think when I was talking about that issue of portability, and it had to do with the long-term care insurance. All right, if you have a long-term care insurance policy, and if you have one that's a New York State partnership policy, can you use it in another state? And that's, you know, and then qualify for that state's Medicaid. Okay, that's the portability issue with partnership policies.
So this all tells me it's always important to ask your question and to try to get answers from people who are working in this field. Steve, thank you so much for charging through and providing so much information. Every time I hear someone present on this topic, I know something new becomes clear. This is one of those areas where I think we have to hear it a few times to really kind of get it. So thank you for your patience and your knowledge and you're giving us the time to share what you know.
Well, thanks for attending today. So everybody,
and those of you who have, and anyone who we didn't answer your direct question, we're gonna get back to you. Bruce, do you want to take over?
Yeah, just another minute, folks. I just wanted to take two more things. Wanted to just thank for a moment all of our sponsors. I'm going to bring up on the screen. These programs would not be possible without the folks that I'm showing on this screen, including Deep Mukerji, who's what we call a friend of Senior Law Days. Thank you, Deep, and also thank you to Elena and the Westchester Library System as a sponsor for all of your support for us. And then the last thing I'm going to do, if people have a moment, I'm going to launch a quick poll whereby you can give us feedback on the program. So you should be seeing that now, and we'll just wait a moment. And
please go to the website to ask any other questions. I know you have them.
Okay, well, thanks everyone, and have a great day.